Hi, I'm Dr. Pelto, working at Central Massachusetts Podiatry, and I'm doing this video because I had a patient that asked me if the wound of their foot after removing a wart looked okay. Many patients, they get warts out in the office, and then they're unsure, is it infected? Does it look okay? Is it healing okay? They have questions on how long it's going to heal. And I want to go over all of those in this video. I am not going to go over all the treatments for warts. At the end of this video, I'm going to include some other videos if you want to watch about all the different treatment options. One of the last treatment options, or sometimes one of the first, depending, is a wart removal. So let me explain, when would you do a wart removal? In my experience, if you have only one wart, you can remove it. It's just a little bit faster than doing the other treatments. If it's on an area that's less painful, you can do that. If it's one or two, I'll remove them. Maybe I'll offer to a patient to do it initially because it's just easy to do. You just numb it up. You put a little Novocaine, and I like to use a little epinephrine, which just draws the blood out of it, and it's going to heal in 2 to 4 weeks to 6 weeks, depending on how deep it goes. Otherwise, the other reason is after I exhaust all the other types of treatments and it's not getting better, or the wart is just so large that we want to remove it, and it's been there for such a long time. So when we remove the wart, like I said, we numb it up. I numb it up and I cut it out, and then I put a bandage on. Make sure if you have a doctor doing this for you, you are going to have them to put something called Adaptic on there, or a non-stick dressing. So a dressing without sticking, or really lather on the triple antibiotic so it doesn't stick. That's a really important thing to give you more comfort after removing a wart. And then when you're going to be looking at it, you're going to take the bandage off, you're going to look at it, and that's where you might get scared. So I'm going to show you a picture here of what it looks like. So just bear with me. So this is an example of a patient of mine, and they had a wart. Okay. And here's the example on the big toe. I removed it. It was 2 warts, and it looks like 2 islands. So there was 2 of them, and I probably could have just done the whole thing here, but I didn't. But I took out this piece, and this is an example of someone 2 weeks out, or 2 weeks after the surgery. This is a nice red tissue. It looks nice and healthy. This white tissue is fine. It's a little bit what we call macerated, or when you have dishpan hands, or you go in the water too long and it turns white. It was probably because there's some drainage here, or it was from the triple antibiotic. This type of a wound is going to heal probably in another 2 to 4 weeks. What will happen is it will scab over, and then that scab will fall off. What are the drawbacks with removing wounds? With removing warts, is that it could develop a sore underneath it. It also could, not a sore, but a scar underneath it that could be painful. And then the other challenge with removing warts is sometimes at the periphery, if we don't get the whole wart, there could be other warts that are removed. The way I do it is I take a marking pen, like a Bic pen, black pen. If I was going to remove this, I would just mark all the way around it, numb it up, and I would cut around the edge. So I have a good 2 to 3 millimeter border around it. And I remove it quite aggressively in the office. So that's all about warts in terms of removing them, what you can expect. I'm going to include another video that you might like about warts if you want to deep dive into treating warts. If you have any other questions, please post them underneath. I will try to answer it in another video. And thank you for being here. Subscribe if you like this video. Okay, thanks.